Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Public comment, we have none. Approval of the June 5th, 2024 Health and Human Services Committee meeting minutes. Motion made and second. All in favor? Aye. Any opposed? Motion carried. Policy issue discussion, potential committee determination. We have none. If there's no objection, I'd like to move 7B if there's no objection. Yep. Which one do you want, John? 6A? Oh, never mind. We're right in the line anyway. Sorry. 6A, go ahead, Supervisor Robinson.
Thank you, Mr. Chair. I'm here today just to refresh your memory relative to the budget process and what we're looking for out of the committees. And is some of you remember 2 years ago we went through the budget process and there was a request for more participation on the part of the county board earlier in the process as well as later in the process. And last year we did the budget 101 and we began the process. We brought in the budget priorities, which we've already done for this year's budget, which you approved last month. And this year we'll be bringing in budget assumptions. But part of the process is we're also looking for the committees to go through the programs within their area of review under the rules of the county board and look at a number of things. Look at the priorities, programming priorities. What should we be doing? And should we be doing something different or backing off on something? Where do evaluating mandated versus discretionary programs, and I think that there are different levels of mandates. The state may mandate the provision of a service, but how or the degree to which we fulfill that mandate is open for interpretation. But we would ask that you review those programs, whether it is in the health department, social services, North Central Health Care, or others under your purview, and provide input so that the administrator can take it in shaping his budget, and then we can consider it the finance committee. Ultimately, the budget is a county board document expressing the priorities of the county board as a whole. But we would ask that you go through the mandated program. That information was presented to you in your packet for the meeting today. There's a lot of information there, and this is an iterative process. It doesn't have to be done at this meeting, but rather between now and the adoption of the budget in November. We would also ask that you look at your fees. One of the budget assumptions that we'll be bringing in tomorrow is that public charges will go up 3%. We need to increase that. We're looking at wage increases of 3%. We're looking at healthcare costs of going up 8%. We're looking at other increases. And if we don't keep the fees that go to support those programs current, we won't have the revenue necessary to support those programs. So we would ask that you take some time, step back, and look at where you have discretion. Some of the fees are set by the state. Some of them can't be increased because you won't get people paying them, but you'll have to balance out those factors and look at them, but make recommendations on where those fees might be adjusted and what the impact of those might be. And then again, provide the input into the programs, the priorities, look at those areas that are external to the county, our work with our nonprofits. The women's community kind of falls within this, and public safety, but look at some of the other programs where we're providing assistance to nonprofits in exchange, for their providing services to the residents of the county. So I'll turn it over to Administrator Leonard.
Sure. Thank you, Mr. Chair. Just to kind of reiterate the process, this was something, again, we put in place last year based on feedback from the previous board as we always try to improve the budget. So it's largely a copy of that process, but just to highlight three of those areas that as
HR Finance and Property Committee Chair Robinson referenced, where I think we have historically framed clear opportunities for the county board to exercise its policy-making authority relative to the budget. And as Chair Robinson said, as by virtue of this new process that we put in place last year, there are more opportunities early, but also later in the process for that. So what's one of the first policy question on which each of the standing committees and then the full board can act to impact the budget is what programs or services do we offer? And that's the question. And as Chair Robinson referenced, you've heard us say before, we're an arm of the state, so the state often says you have to do something. So that's where that mandated and discretionary program list comes in, and that is in your packet. It begins on page 3. I'm not going to go through the 50 plus pages today. I would say it's for your benefit. It's probably more for mine. That would be excruciatingly painful for me. But just remember, it's at a high level. But each standing committee really take a look at that high level. What are the programs or services that we offer? The document was updated this year to not in a substantive way to really change what it conveyed, but just hopefully we made some grammatical changes that made things more clear for you. But within your sphere of influence, within your for this standing committee, take a look at those departments that you have oversight over. If you have a question about a particular program or service, hey, help me understand what this is. We'd be happy to just please reach out to Chair Boots or myself via email, and we'll add that on an agenda. Make sure we have the department head there to answer questions. We do have a number of department heads here. If you have a burning question at this point that you want some clarification on, but the document is organized largely from information that I got from a colleague from St. Croix County. I think it's a very sound document in how it's organized. Again, what's mandated, what's not. As Chair Robinson referenced, that idea of what is mandated and what it's not, the state frequently tells us we have to do something, but they don't always say in very explicit detail, and this is exactly how we want you to do things. Here's an easy example. We need to provide a county highway system. They don't tell you how many miles you need to have, and they don't tell you what your PACER rating needs to be, your pavement rating. So that's that second question. So the first question is, what programs or services do we provide? The second one is, as alluded to by the chair of HR Finance, at what level? What is the service level you as the county board want staff to strive to accomplish? So what does that mean? I think there are a couple ways that have been helpful for me to think about service level. One can be a population, a target population. Is this program meant to serve everyone? Or is it only meant to serve people that meet certain, perhaps income thresholds or a certain area of the county? And you have programs that do that. We've had conversations about, historically with Start Right and now the Nurse Family Partnership, really how many people are we seeking to serve? So that can be target population. Another one I already alluded to can be quality. I talked about the highway department and maintaining a highway system. The state doesn't say you need a PACER rating, a pavement rating of 7. The county board, Marathon County Board, has said we want an average PACER rating on our highway system of 7. That's our goal. You set a quality measure. And then the last one that I think is a good level of service is timeliness can be a good way we measure service. So you're not required to have countywide zoning. There, you can say, hey, we're out of the zoning business. That's a municipal function. But Marathon County has said we do want zoning. We have county zoning. Well, when you have county zoning, you have to review permits and applications for various things. You can have an expectation of a turnaround time on a permit review of 7 days, 14 days, or 40 days. If you hear from constituents that it's taking too long, I know, it's been my experience, I know what's going to happen. You're going to reach out to me, and then I'm going to try to figure out what do we have in terms of an issue. We had a number of years ago, I'll give an example, we had a lot of recorded documents coming through. Interest rates were really, really low. People were refinancing mortgages. People were buying and selling property very frequently. It was happening really fast. The number of recorded documents went up, which created a bit of a lag for us in terms of processing those things. So we tried to improve our service level, and the board helped us develop that strategy to do that. So again, that second question is, the first question is, what programs or services? The second question is, at what level of service? And then the third one, as the chair of HR Finance, Chair Robinson referenced, is at what cost? We have a number of programs where we have the statutory ability and or requirement to charge fees. Other programs we don't. So a simple example, the easiest example that I use often is, you're not required to have county parks, and you're certainly not required to offer camping in county parks, but you have. That has been a program and service offered in Marathon County for a great many years. So what is the appropriate fee you charge? Or you think about conservation planning and zoning. We have fees for various permits. Some fees are set, as Chair Robinson referenced, by statute. Metallic mining is pretty clear in what you can charge and what you can't. You have to charge the full cost of running the program. But where you have discretion, what is your expectation? What is that sharing of cost? Is there enough of a public good from that program or service that you want to essentially, through tax levy, subsidize the delivery of that program or service? And I just want to show you where those programs and the fees, the rates and fees are. They are within the annual budget. Historically, we just included these last year as part of this updated process. They're in each of the department sections for the budget. So this is the conservation planning and zoning section of the budget. You'll see, and it talks about their team, how they're organized, some of their accomplishments. Here are the rates and fees that we used at the time the budget was adopted. The health department is one of the departments over which this committee exercises oversight. You'll recall, for those of you that were on the board last term, undertook a wholesale review at the Board of Health, and then it worked its way through the process, updating the fees. Completely new fee structure with a fee philosophy. That is, again, that third area where the third policy question, at what cost do you want to offer those services, where you have the authority to change those fees. Some fees, again, within the health department, for example, are set by the state of Wisconsin through DATCAP or other agencies and what we can charge. And I also think that when you start thinking about fees, there's one other piece of information that I think it came out last year in the budget discussions that resonated with me, and I think it's certainly something we try to talk about through the budget process. And it's the idea that not every dollar in the county budget is the same. So Krista's here from Social Services. I'm going to be ballpark numbers here on the Social Services budget, so it's going to be accurate but not precise. About $20 million, Social Services budget. But of that, 1/3 is tax levy. 2/3 are dollars from other sources, reimbursements, state reimbursements, what have you. So $1 of every three. Now, it's not it's not like every dollar we spend in social services, 33 cents is levy. Certain programs have higher reimbursements or different funding streams. But that idea is important. And you contrast that with, and I'm not picking on the sheriff's office, their ballpark budget, let's just say it's about $27 million. 90+% of that is tax levy. It's because they don't have the same funding streams that we have with some of the other programs. Health department, similar, a lot of grants and other reimbursements, some fees for service. So when we talk about costs, at what cost we deliver these programs, it's that idea also of remembering, hey, if your goal is to impact the levy, the tax levy, we really need to please ask questions and we can help you understand what, if any, impact it's going to have on levy. For example, we have some programs that are 100% reimbursable. Children's long-term support, if we are delivering certain programs and services under that, we are getting full reimbursement. So cutting that first of all, probably puts us in jeopardy of meeting some of our mandates, but it also isn't going to have the impact you want if the impact you really wanted was an impact the levy in a certain way. So those are the three, again, those high-level three policy questions. Happy to answer any questions you have about specific programs or services today. I will qualify that by saying if you ask a question I don't know the answer to, you're going to get the response that I will come back with an answer. But thank you for the time, Chair Boots, on kind of teeing up that budget discussion about programs and services.
Any specific questions for Administrator Leonard? Anybody online? Questions? Okay, with that, we'll go to 6B, discussion possible action by Health and Human Services. I guess, is there anything on the front end, I guess, that we have questions on? Otherwise, I will leave us to look at this for the next meeting. But if there's anything on the front line right now that you have specific, go ahead.
I caught the Wausau Community meeting of the whole on Monday, where he gave a little presentation, and a number of the alders had expressed interest in a city-county partnership when it comes to the homeless population. Is that something we want to have on a potential next talk about?
So just as a informational, Administrator Leonard, myself, Matt Barnes, and Chad Billa will be meeting tomorrow for our initial discussion on that and what the actual ask is by the city, and then kind of going through those things, and then we'll get people involved as we know more. So that's going to be tomorrow. We're just going to meet just to kind of put some ideas together. So yeah, that is something that we are going to be looking forward to meet further in the meeting. So go ahead.
Thank you. I'd be negligent if I didn't bring up the issues of crisis assessment response team expansion. And it's something that came out of the Wausau Policing Task Force, which I had the privilege of chairing. But currently we have the officers in the crisis facility working jointly and trying to deal with issues that the law enforcement is experiencing. And unfortunately, the services are generally 8 to 5, Monday through Friday. And there's a need to expand those into the evenings and the weekends. And I think there have been concerns about the ability to hire crisis staff to support it and the funding of it. But I would just encourage, as part of the discussions and deliberation of the next year's budget, to consider the potential expansion of that program. I know that they are pursuing grants, and so some of the costs may be offset. And then the second area that came out of the policing task force was the need for management, in support services and sort of the mental health support for many of the people that come to the system. I think when you look at people that present themselves to jails and the crisis center, there's a significant amount of overlap. And in many cases, those people need help getting back on track so that they're not high cost, high utilizers. And a mental health component and case management of some of those individuals would be an important service that we should evaluate and consider expanding. I know we have some services, but there's concerns about whether they're adequate to address the needs. So I would encourage you to look at those two programs going forward.
Anything further? I did go to NACO, excuse me, this last week, and did go to several breakout sessions, and some of the things that John is alluding to were covered. The three people in the corner know a lot about this, I'm sure. More, it's just a matter of what our policy will be to deal with that. I can honestly say, listening to the speakers, both Thursday and Saturday. Saturday was the longest day by far. Or no, I'm sorry, Sunday was. And the Sunday breakout session, I think Marathon County, honestly, is ahead of the curve. That doesn't mean we have to stop, but we're ahead of the curve compared to what I've been hearing from other counties across the nation. So that was good to hear. But anyway, go ahead.
Thank you, Mr. Chair. I think one of the, of course, the policy questions, these are things that are going to work their way through the standing committees and ultimately the full board. But it's been my sense that, I often say words matter, and really being very intentional in what we're trying to talk about. I think to Chair Robinson's point about case management can mean a lot of different things. And there are, quite honestly, in my experience, I'm coming to realize there's a lot of different types of case management for different services. And I certainly don't claim to be an expert in this area, but the idea of some of the barriers, and Chief Barnes brought this up in a roundtable meeting this morning with Senator Baldwin, talking about the, Maslow's hierarchy of needs and really case management relative to housing. When we have individuals, if they're working with North Central or working with social services or any of our agencies where we're delivering some other type of service, maybe it's substance abuse, they're seeing us through outpatient clinic, or they're recently discharged from the inpatient hospital or crisis stabilization, or maybe they're recently discharged from one of our correctional institutions at the state or local level. Housing case management is an area where we don't have enough people that can assist those individuals in maintaining safe and stable housing. And we have to be very intentional. My sense is we have to be very intentional about putting resources toward that form of case management, as opposed to simply saying, hey, we need more case management and adding it in other areas. Because if you're not intentional about what the case management is around, we can deploy all sorts of resources, and I'll just say relative to substance abuse or mental health. But if we don't have the resources in place to help people understand, one, how to just maintain the housing you have, but also perhaps get on a pathway. I just had a meeting with a supervisor earlier that said something very profound. It was a pathway to like home ownership, right? Like a pathway to something that is truly self-sustaining. It's a lot of effort in all those other areas and success can be limited. I know this committee is very familiar with our Family Keys pilot program. I think that's the part of the success is it's a big focus on, quite honestly, we're doing a lot of the same things we've always done in terms of our social services work, but it's the really targeting that housing case management. And I'm probably oversimplifying it, but there are a lot of people that don't have the lived experience that I have, or I'm sure many of you have, that where you had those good role models as to what it looks like to stay in safe and stable housing. Again, to Chair Boots's point, I think we are ahead of the curve in that city council meeting. I took a couple minutes to just jot down. I didn't realize, I guess, I was going to have as big a presentation as I had, but just eviction. We have a lot of people who have been evicted multiple times, and what does that do for your ability to maintain safe and stable housing? It makes it exceedingly difficult. Well, Marathon County has been a leader in that. You've allocated money to a mediation program that sits down landlords and tenants and tries to say, hey, let's work out your dispute before you go in and get an eviction on someone's record. So we just need, my sense again is the county doesn't have many housing case management programs. In fact, you have really, apart from Family Keys and the money that you allocate through the budget annually to North Central CAP services, for a couple of targeted populations, when I talked about service level again, you have a couple of targeted contractual provisions. We really don't have a lot. And I would also say that it's not entirely, there's not a lot of examples in the state of Wisconsin that I'm aware of where counties are doing a lot around housing case management. But we certainly can look at, if there's a desire to kind of look at what are opportunities for creating that, please have those conversations here and provide that direction, and we'll do what we can to start the conversation.
All right, is there anything further on anything 6A through 6C from the committee at this point? All right, thank you. We'll move on to 7A, update from Social Service Director, including the Youth Opportunities Center pilot and Family Keys program. Thanks, John.
Good afternoon. Thanks for having me. So just a brief update for you. Our Youth Opportunity Center has been open since June 4th, so just a little bit over a month. And since that time, we have served 11 unduplicated youth. So things are going relatively well, as can be expected from a new program. We've really seen some of our youth step up and start to be mentors to the other youth who are present. A brief example, we had a youth who raised their fist at one of our staff members and was getting upset, and another youth stepped in between and said, that's not how we behave here. That's not what we're going to do. You need to take a break. So really I think that's different than what we thought. We didn't really think we'd see such great mentorship from some of the other youth who are attending the programming, so I'm really excited about that. We will be having an open house at the Youth Opportunity Center after the county board meeting on July 23rd. So I'm hopeful that you'll come and join us. It should be a pretty brief tour. It's not a huge space, but there is, you'll be able to see where our youth spend most of their time. You'll be able to see the rec space, the garden space. One of our youth actually built the fence that's around the garden. We've been able to have some presentations come in already. We've had our youth learn how to fix drywall already. They did their orientation at the Humane Society a few weeks ago, so they'll be volunteering there and doing some community service. So it's going overall really well. Questions on the Youth Opportunity Center before I move on to just a brief Family Keys update?
Any questions for the committee? Anybody online? All right.
Okay, so moving on to Family Keys, as we've spoken about a little bit, the program continues. We continue to have funding through July of 25. As this board is aware, we do continue to seek opportunities for grants and community funding. I intend to bring all of those hopefully at once instead of coming to you multiple times over and over, because we'll be able to use that funding into 25. So we currently have 9 families enrolled, 2 families who are getting ready to discharge successfully. And of those 9 families, we have leases in 3 of the families' names. So as Administrator Leonard was recently talking about, the prior history of evictions has been a big barrier for families to be able to sign their own leases. And so the fact that we've been able to establish partnerships with landlords who have allowed families to get that experience of having their own name on a lease, sort of help to build their credit in that regard, has been really exceptional. We've had great outcomes with our landlords who've been willing to help serve our families because of the partnership with North Central Healthcare as well as social services sort of backing these families. We are beginning a new outcomes report, which will include all of the same things that you saw last year around sort of the cost-benefit analysis, how many families we served, how many children we prevented from removal and reunified because of this program. But in addition, we will look at our families who have already successfully or unsuccessfully left the Family Keys program and see where they're at today in regards to, have there been new Child Protective Services reports? Have these children been removed subsequently following the program? Are the families still in housing 6 months, a year afterwards? Really, how are things going for their families? And get some feedback specifically from those families on what their thoughts were for the Family Keys program. So in addition to that cost-benefit analysis and all of those numbers, we'll be able to bring you sort of some of the follow-up data as to how this program seems to have impacted the families who have left already. In addition to that, the Department of Children and Families and the 3 counties who are participating in a Family Keys film. So it will be sort of documentary style. The individual who shoots Discover Wisconsin is the production company for this, and that will be hosted at Marathon County in our conference center next week, Wednesday and Thursday. So we have at least 2 families from each of the participating counties who will be coming, who will be sharing their stories, and really sort of putting them in the driver's seat of what are the themes that come through, what sort of questions are asked, what do they want the community to know. And then we also have additional community partners. So there's individuals like housing navigators and case managers, law enforcement partners, school social workers, county social workers who will also be involved in this Family Keys film, with the intent to deliver 3 short films to sort of 3 different realms of people, from families who would be participating to what they're calling community banks or funders, and then state and county boards, about why this program is important, how it's impacted families, and how it's impacted communities. So I have never been a part of a film like this, and it will be a very interesting process, I'm sure, but we'll be excited to share that with Marathon County, hopefully this fall. They're anticipating it to be ready for rollout coming up here. So those are some of the updates.
Questions from the committee? Go ahead.
Well, that's certainly exciting, seeing that. I know we went through a lot last term with making decisions towards that. It's good to see that it's being successful. I'm wondering if the film that they're doing, the documentary, if they're going to be showing it to other counties to encourage them to get involved in the Family Keys?
Yes, that's absolutely one piece of the intent of the film, is for other counties to come on board, for other county boards to recognize why this is important, for legislation potentially to put funding for other counties and really try to expand it because of the positive benefits we've seen for not just families but communities overall.
Follow up, please. So are other counties involved in the filming too? Or is it, well, you did say that, yes, but I didn't know if they're around here or they're throughout Wisconsin.
So the other 2 participating counties are Wood County and La Crosse County. So they are the other 2 counties who received funding from the Department of Children and Families. So they're the other 2 who have the program currently. And they'll be bringing their Family Keys teams and families here in order to sort of shoot this film, with the hope of delivering it out to all of the other counties for their utilization.
Excellent. Thank you.
Welcome.
Anyone else? Anyone online? Nope. All right. All right. We'll move on, I guess. Thank you.
Thank you.
So 7B, 2024 first quarter financial reports, budget to actual for Department of Jurisdiction.
All right, I'll kick this off. So within your packet, you actually have all of the individual departments' budget to actuals, and I apologize. This is actually still the first quarter. You're going to be getting the second quarter very shortly, hopefully at your next meeting. But you have all of the departments. We'll try to make sure we just have the departments that are kind of within your scope of oversight. But this was a long-standing request from the county board and certainly from HR Finance to get in front of each of the standing committees, kind of those budget to actual reports on a quarterly basis. So this is the first quarter, so it's a bit aged, but happy to answer any questions you might have. I'll give you the kind of high level. Bottom line up front, there's nothing, at least in the first quarter financials, that I would say was, oh my gosh, this is shocking. You'll see this from each of them, and I just put the health department up there for purpose of illustration, but generally speaking, relative to personnel, we're about, at the time that we ran these reports, we were about a quarter of the way through our budget, which is where you'd expect to be a quarter of the way through the year. We did find some anomalies, and I'll again put one up here that this was a mapping error in terms of employee benefits. You'll see that our original budget for this, on this line item for employee benefits, was $2,066, and we've spent in the health department, it was more than just shy of $4,800. It was a mapping error. Christy explained it prior to her retirement better than I could, so I'm not going to try. If you're all that interested, I'll go pull up the explanation she gave to HR Finance, but it's a mapping error. You'll see it's a relatively small dollar amount. We're going to correct it for our budgets next year, but it's not causing any, it's not a concern from a budgetary standpoint. If you have a specific question about individual departments and line items, happy to answer those, but one of the things we covered throughout our standing committee presentations was county budget is a little bit, it's certainly different than what you might expect in a private business where you're creating a product and selling a product throughout the year. In that instance, you might expect your revenues and expenses to track pretty consistently, right? Our budget is different. We have some revenues that come in all at once, early in the year. Property tax is a good one. And we have some that come in different throughout the year. We might have a grant that we get reimbursed on at the end of the year, or we might just have the revenue cycles don't necessarily match. The same is true with some of our expenses. I know this personally with respect to my administration budget. I have contracts that I referenced before. North Central CAP, one of the nonprofits that the county board funds annually through the budget process. I have all those nonprofit funds in my budget. Well, the nonprofits are really, really good about getting the contract signed in January and sending a bill so that they get paid. So my line item in that area is 80+% expended, where we have other contracts for services where we pay at the end of the year. So a line item might be, you might have an expense line item that is very, very delayed. And you'll see that in some of these. We have special services line item for the health department. Well, we've only expended 0.71%. The revenue and expense numbers don't track in a linear fashion. So with that high level overview, if you do have questions or concerns about any particular budget or want to know a bit about how those departments are funded, similar to the discussion we had relative to budget, happy to look into those questions. I know we had a line item in the sheriff's office budget that there was a question, well, why is this? This was a substantially, we're most of the way through this budget line item. What does this refer to? And we were able to answer that question shortly after the meeting. We had Christy pull some data and explain why we'd expended most of that line item. So that's a lot of general information without much specific, but happy, Mr. Chair, if there are specific questions about departments, questions or concerns to try to answer them.
Pulling back up my agenda, sorry. All right, any questions for Administrator Leonard? Okay, then we'll move on. Next meeting, date and time announcements and future agenda items. Committee members are asked to bring ideas for the future discussion. Like I mentioned earlier, I'll be meeting with some people tomorrow about the homelessness issue, and probably talk a little bit with Administrator Leonard on the CART and case management thing that Supervisor Robinson brought up. So anything from the committee on 8A they would like to see, or they can call, as always, or email Lance or I. All right, with that, next meeting is Wednesday, July 31st at 3 p.m., and I will take number 9. Motion made to adjourn. Motion made and seconded. All in favor? Aye. Any opposed? Motion carried. Thank you.